so many people are taking their pills, they're doing their therapy, they're doing everything in their power, and they're not getting better. They are
Hmm.
not getting fully better,
Yeah.
and they are struggling. And what I'm here to say is there's hope. There is hope for those people, for you. If people understand the metabolic theory, the metabolic basis of brain disorders, we can help people heal and recover. And as we talk, so it helps us understand current treatments a little better,
Hmm.
but it also opens up entirely new possibilities in terms of new medications we might think about, weight loss drugs, maybe for your brain health as well, but also dietary interventions like the ketogenic diet or other exercise, sleep, and other things.
Hey everyone, I'm really excited to have a special guest on today. It's Dr. Chris Palmer. He's a Harvard psychiatrist who's been researching the connection between metabolic disorders and mental health disorders. He's also the author of the book Brain Energy, which lays the case for metabolic disorders underlying or being the cause of many mental health conditions. And he's starting to see a lot of results with metabolic treatments, which include keto diet, intermittent fasting, certain medications, sleep, exercise, and other metabolic treatments having a really massive impact on improving mental health. And this is kind of the leading edge of the future of mental health treatment. So, really excited that he was willing to take a few minutes out of his busy day to talk with us. Let's jump in. Thank you so much for being here. Really, really appreciate it.
Thank you for inviting me.
Yeah. So, can you tell us as briefly as possible what's the underlying theory behind metabolic treatments for mental health?
So, the underlying theory really is that the brain disorders that we call mental illness are largely metabolic disorders impacting the brain. And although metabolism gets really complicated fast, the reality is that there are some treatments that are actually quite simple: diet, exercise, sleep, lifestyle factors that can actually play really a foundational role in treating mental illness. And I think the shocking thing, so most people hear that and they think, well, yeah, of course, good diet is good for your health and maybe mental health. The shocking thing is that when you actually understand the science, you can use specific dietary interventions, for example, like the ketogenic diet, to treat really serious, severe chronic brain conditions like schizophrenia, bipolar disorder, and other mental health conditions.
Yeah, it's fascinating to me, and I'm so excited to watch these studies roll out and to see like this nutritional mental health approach or this holistic or metabolic mental health approach. I've been following and talking with Lauren from Living Well with Schizophrenia for a couple of years. Are you familiar with her story?
I am familiar with her story. I just was in at a retreat, a metabolic psychiatry retreat with her in Florida a couple weeks ago. And Lauren is just a phenomenal person.
She's awesome. I love the work she's been doing, and I'm gonna play a short clip of her for my audience. But I also have seen other people experience some pretty big changes when they've made these metabolic shifts. So we're gonna talk a little bit about. I want to hear your perspective on the ketogenic diet and how that impacts metabolism. But first, I'm just going to share a quick story. Is that my friend, who is also a therapist, has had horrible migraines for years, but recently, as she's going into perimenopause, they're getting worse and worse to the point where she wasn't able to work anymore. And she tried about 10 or 15 different treatments, including medication, including lifestyle changes, including seeing a chiropractor. And finally, her migraine doc said, let's try a medical keto diet. And she's basically not having any migraines anymore. She ate some chocolate on Halloween and got a headache the next day, but it's like her symptoms have gone down by 90%.
Wow. Congratulations to your friend. That's an amazing story. And to me, the thing that's so hopeful about stories like that is that it's not that medical keto is going to cure everyone,
Mhm.
but it opens up entirely new ways to understand these illnesses and completely different strategies other than just try another pill. It opens up completely new strategies that we should be considering.
Okay, let's step back a little bit because I love your take on that. I've read the first three quarters of your book, and I love how you explain from a medical doctor's perspective how the overly simplified explanation of, oh, a chemical imbalance or low serotonin is not the most effective way to explain the underlying cause of mental health conditions. I know this is complicated. This is like four chapters in your book. Can you give us a very, like a brief explanation of how metabolic conditions, or can you debunk the chemical imbalance theory in 1 minute?
So the chemical imbalance theory has been debunked for people who don't know it. And researchers have spent decades doing brain imaging studies. They've been biopsying brain tissue. They've been looking at the fluid that surrounds the brain and the spinal cord. They've been tirelessly looking for the chemical imbalance, and it does not exist. So that is unequivocal. Now, that does not mean that medications that affect serotonin don't work.
That's right.
It just means that our understanding of how those medications work is wrong. The medications are not correcting a chemical imbalance. And instead, what I encourage people to think is that the medications, including SSRIs, are actually improving brain metabolism. That when they do work, that is how they're working. So the bigger picture, though, is once you understand that brain metabolism is fundamental to the function of the brain, once you understand this bigger picture, you can better understand how some medications might reduce symptoms and how that might actually not be good over the long run. That medications that impair brain metabolism can sometimes paradoxically reduce symptoms in the short run that might become addictive and or lead to chronic disorders in the long run. And so understanding the details gets super complicated, but it is understandable, certainly for clinicians and for people who are interested in science. They can understand this. But once you understand it, it opens up entirely new ways to think about and treat mental illness.
Yeah, I found that fascinating as I read your book. And I loved your description of how the metabolism is connected to our brain health and our brain functioning overall.
The easier, simpler version that I would offer is that when we put food into our mouth and it gets absorbed and goes through our bloodstream, it gets broken down serially into smaller and smaller pieces, components, molecules, chemicals.
Okay.
And our cells need those chemicals from the food. Our cells need those byproducts from the food, and they use it for two things primarily. They use our food for energy production, so it creates energy so that our cells and our bodies work. But it also gets converted into the building blocks that make up our cells, that make up our bodies. And so that is what metabolism is. And metabolism is actually kind of fundamental to the definition of living organisms. So it is massive, super complicated. The simple version is food into energy and building blocks. And that's what powers our brains. That's what makes us function. That's what makes us healthy and or not healthy. Yeah. And when there are problems with metabolism, fundamentally, there will be problems with the way cells function. And when cells in your brain are not functioning properly, you can have symptoms of mental illness.
Yeah. Okay. Thank you so much for giving a more clear but specific definition of that. So understanding mental health from a metabolic approach, what options does that give us as far as treatment, and what are we learning from the research and studies?
So I think one of the things is that we're not going to throw out what we already know. So of course, psychotherapy works for so many people. And of course, medications work for so many people.
Yep.
But this theory helps us understand how and why maybe those are working in more sophisticated terms, in more complex terms than we currently maybe think about them. Mm-hmm. So again, like we discussed before, the medications aren't correcting a chemical imbalance. Instead, I want you to think about them as modulating your brain metabolism. And once you understand that, then you can understand, is this helping brain metabolism or is it hurting brain metabolism? Both can actually have beneficial effect in the short run, paradoxically. But
Yeah.
once you understand that, then you can make more rational decisions about what treatments you should do, maybe in the short run because you're in crisis, or because you're suicidal, or because somebody's having a psychotic episode or a manic episode or severely depressed. That yes, we're going to use whatever we need to use to save people's lives and to help people, be okay. But then we can think more in a more sophisticated way over the long run. How can we help this person heal and recover? And so many people are doing the best treatments they've got. So many people, I see them every day in my practice. So many people are taking their pills, they're doing their therapy, they're doing everything in their power, and they're not getting better. They are
Hmm.
not getting fully better,
Yeah.
and they are struggling. And what I'm here to say is there's hope. There is hope for those people, for you. If you people understand the metabolic theory, the metabolic basis of brain disorders, we can help people heal and recover. And as we talk, so it helps us understand current treatments a little better,
Hmm.
but it also opens up entirely new possibilities in terms of new medications we might think about, weight loss drugs, maybe for your brain health as well, but also dietary interventions like the ketogenic diet or other exercise, sleep, and other things.
That's fascinating. That's such an interesting lens to take on this. And I think when we look at whole body health, maybe we could see anecdotally or through studies that sleep really helps mental health, like healthy sleep and a healthy diet, a good rich diet helps mental health. And exercise is one of the most effective treatments for mild to moderate depression, for example. But understanding them from a metabolic lens, these all help support a healthy metabolism, correct?
Absolutely. Exactly. And that's why, on the surface, some people say, well, we already kind of knew this. This is so obvious. Everybody knows it. And yes, that's true. Unfortunately, not everybody going to mental health professionals is getting that kind of advice.
Right.
Sometimes they're just being asked to take another pill, and
Mm-hmm.
nobody's really talking to them about how can you get better sleep? How can you improve your diet? How can you get some exercise or build some exercise into your routine?
Mm-hmm.
Sometimes we're not taking the time to do that with people. And then, as I said, for even severe chronic cases, if you really understand the science, you can get super sophisticated and think about ketogenic therapies to treat very serious disorders like schizophrenia and bipolar.
Oh yeah. So let's jump into that. I've read a couple of the studies that have come out where they're treating, yeah, schizophrenia and bipolar disorder with a medical keto diet. A medical keto diet, as I understand it, is, tell me if this is correct, under 20 carbs a day. Is that about right? Or even less?
Usually, yep.
Hmm. And one of the studies out of France, they took 30 people in a psych ward. They did keto therapy and some massive decreases in symptoms with the 27 who were able to stick with the diet. That's
Yes, so those were patients who had treatment-resistant schizophrenia, bipolar, and depression.
Mhm.
And I think it was 28 of them who were able to do the diet total.
Mhm.
And of the ones who were able to do the diet, 100% had at least improvement in symptoms, but 46% had remission of illness. That doesn't happen with current treatments. Remission of illness. And these are people with schizophrenia, bipolar, chronic unrelenting depression.
Yeah, pretty crazy. So what can you say about that? Are there other studies showing that efficacy? Where are we going with this?
There are. So right now, the great news is we've got about 20 clinical trials worldwide of the ketogenic diet for mental health conditions.
Cool.
8 of them are randomized controlled trials,
Great.
meaning that patients are getting either a ketogenic diet or something else, like a different dietary intervention, so
Mhm.
that we can compare it. And so a lot of that research is going on, but we had a study just published a few months ago from Stanford Medical School looking at 21 patients who had treatment resistant bipolar disorder and schizophrenia. And I think it was over 70% of the patients had clinically meaningful improvement in their symptoms. Everybody who came in with metabolic syndrome reversed their metabolic syndrome.
Oh.
Most of the patients lost weight. And then there was another study in the UK in patients, about 20 patients with bipolar disorder. What they found was that patients who did the diet, the higher the level of ketones, the greater the improvement.
Oh, I
And they
saw that
noticed
one. Yeah.
And they noticed improvement in impulsivity, mood, anxiety, and other symptoms of bipolar disorder.
And they could correlate that with the ketones. So just to back up, when you do a ketogenic diet, you're shifting your, you can tell me if I'm correct on this, shifting your energy supply basically from carbohydrates to ketones. Is that right?
Yes,
And it's a more, oh,
the body will always use some carbohydrates. So
mhm.
there are always, and even if you don't eat any carbohydrates, your body makes glucose on its own.
Okay.
But yes, you're definitely shifting metabolism much more toward fat and ketone energy.
And that's a more stable source of energy. How does that improve metabolism?
So that's actually kind of a paradox.
Okay.
So that a lot of this work is actually based on this century-old observation that fasting has healing potential in humans.
Oh yeah.
So pretty much every culture has used fasting for healing.
My
And
religious
intro
tradition, we fast one 24-hour period every month.
And there you go.
Yeah.
That's a perfect testament to it. And I think that so many religions and cultures have figured this out. And the reason they built it into their practices is because they recognize this is actually beneficial for human health.
Yeah.
Humans live longer, we're thriving more, we're happier,
More
we're more
peaceful.
connected, we're more
Mhm.
connected to God even. We just feel more alive, we're in touch with ourselves, with our bodies, with the spirit more when we're practicing fasting. And usually discredited by Western medicine. Western medicine that I've been a part of, I've been at Harvard for almost 30 years. Most Western medicine thinks that's all just a bunch of religious folklore. And it's just that it's nonsense. There's no way any of that's true.
Yeah.
The science is catching up. The science
Mhm.
actually tells us, no, it really is true.
Yeah.
And now we can actually understand these biological mechanisms through which it helps.
Interesting. Okay, so if we take this to a practical level, we've got people watching this channel thinking, I want to improve my mental health. How can I apply metabolic treatments to this? I think people could access the resources to improve their sleep, to improve their exercise, potentially improve their diet in a more moderate way, like shifting over to maybe a more Mediterranean diet approach or more fruit and vegetable or vegetable heavy approach. But if they wanted to do other interventions, should they try keto? How should they go about it? On a practical level, what do you recommend? Where would they find someone to help them with this?
Yeah, so this is the frustrating answer that I just have to give. So
Mhm.
if somebody's got a mild to moderate mental health condition, I think it's fine for you to try a ketogenic diet or a low carbohydrate diet on your own. There's very little risk. Millions, literally millions and millions of people around the world are doing it to try to lose 5 or 10 pounds.
Yeah.
It is unlikely that it is going to be harmful. Here's the frustrating part. The frustrating part for a lot of people is if you have a serious mental illness, chronic depression, suicidality, bipolar, schizophrenia, I really implore you to work with a mental health professional on this. And it's not because the ketogenic diet is dangerous. It's because those conditions are dangerous. Those conditions are life-threatening mental health conditions.
Mhm.
And the ketogenic diet is actually a powerful intervention. And when you pair a powerful intervention with a life-threatening mental health condition, you may not always be safe and you may just not, you need the best advice you can get and you need to know how to effectively do it. I also want those people to make sure they're doing it right.
Yeah.
Like if you just wing it, you might do it right, but a lot of people don't. They're not doing it right. They're doing it wrong. They think they're doing it right. And if you have a severe mental illness, you deserve a chance at remission, like
Yeah.
these other people are getting, like Lauren got.
Yeah.
You deserve that chance. And Lauren's a perfect example. Lauren, I had gone on her podcast probably a year and a half ago. And she had actually told me then, I tried that keto thing and it didn't work.
Hmm.
And only when she started working with a mental health professional who knew how to do the medical version of the ketogenic diet has she achieved remission now. And so she's a perfect example of somebody who she did her best. She is such a brilliant, smart, kind person.
Yeah.
But how would she know what a medical keto diet looks like? We can't expect people to know this just off the top of their head.
Mhm.
And so when you're treating really serious mental health conditions, I do ask people to work with their mental health professionals.
Here's the thing that I think people experience on a practical level. Let's start with severe depression. Someone has severe depression, they try studying, they try being grateful, they try sleeping better, they try eating better, they go to their doctor, they try medication, they're still really depressed, they go to therapy, they go to more therapy, they try a psychiatrist, try some medications, those medications maybe help a little, maybe don't help that much. And at this point, they're like, okay, I did talk to a medical professional. Where would they go next? Where would they go next?
My
Psychiatrist?
heart is breaking just listening to you describe, and you and I know there are thousands, if not millions, of people like that in the world.
Yeah, yeah.
And it really is heartbreaking because they are doing their best. They are trying things and they're
Mm-hmm.
not getting better.
Yeah.
And here's the real answer, unfortunately. The real answer is that this is a new field. A lot of mental health professionals don't know about it. They don't understand this science. They don't understand kind of metabolic interventions, and they may not be able to help you right now. I think what I would recommend is there are resources. So if you can come to brainenergy.com, which is a website I'm doing. You can go to another website, nonprofit organization called metabolicmind.org. You
Mm-hmm.
can go to a website called Charlie Foundation. All of these are providing professional and patient and family resources for people who want to learn more about these interventions and what they can do and how they can do them safely, and even like where they might find clinicians who know about this. But the field is in the early phases. It's really exciting because more and more clinicians are learning about this and coming on board. So I'm really hoping soon we'll be able to help even more and more people. But there are resources available, and I would just encourage people to seek out those resources and try to get help.
That's awesome. I really appreciate that. And I feel like my audience is the kind of people who are like, I want to know enough to know like the right questions to ask and the right people to go to. So that's really helpful. I've used up the amount of time. Do you have 4 more minutes or you gotta go?
Sure.
Okay. Is keto sustainable in the long run?
So that's a really common question. And the reality is it is
Mm,
sustainable. And first, I want to just point out that if you're using a ketogenic diet for a mental health condition, it's not at all clear that you need to do it for life. So this is an evidence-based treatment for epilepsy. It
yeah.
can stop seizures even when medications don't. And usually, when people use it to treat their epilepsy, they only need to do it for somewhere between 2 and 5 years. So it's
Interesting.
not a lifetime treatment. It's usually for a few years. And then you can stop the diet and your seizures stay away. And what we're hoping in the mental health field is that the same brain benefits will apply so
Mm,
that people can do a ketogenic intervention for a couple of years and then maybe be able to transition to a different type of a diet, maybe more of a paleo diet or Mediterranean diet or something else,
mhm.
where they can still maintain the health benefits and still stay well and remitted and recovered, but not necessarily have to do the diet. But even for people who end up having to do the diet, there are people with epilepsy who've been on this diet for more than 40 years. And the reason it's so sustainable for them, because this is perplexing to a lot of people, because a lot of people have trouble losing even 5 or 10 pounds
Oh
and
yeah,
keeping it off.
most people
And
do.
so it's like, how do these patients with severe mental or neurological health conditions, how do they do it for so long? These people are fighting for their lives. They're fighting for their brain health. It is so much easier to do a ketogenic diet than to have severe, crippling, suicidal depression. It's not even a close contest. It is
Hmm.
so much easier just to do a diet.
Yeah.
The friend that you just described who had migraine headaches that were treatment resistant, it's
Hmm.
probably a lot easier to do a keto diet than to have migraine headaches and be in bed incapacitated.
Yep.
Um,
I
That is so
asked
much.
her, I said, is it hard to stick with? She's been doing it for 6 months now, and I haven't stuck with a diet for 6 months. First off, I'm not really pro dieting. I'm not a restrictive dieter. I don't encourage that. But second, I was like, well, is this hard? Like, do you miss? And she's like, no, it's not. I choose between eating keto or being in bed with a migraine. It's like an easy choice.
Exactly. And so I think again, for people who don't need a ketogenic diet, I'm not at all suggesting that everybody goes on a ketogenic diet.
Right, right, right.
This is a treatment for pretty serious health conditions. But yeah, for the people who get remission, it really feels nothing short of a miracle to a lot of people. They really do feel like this is a miracle. And I've had a lot of patients even say that directly to me. They really feel that even God intervened for them and that God somehow brought them this treatment and has shown mercy finally once and for all and
Yeah, yeah.
help them feel better. It is that powerful of a treatment.
I believe it. Well, and I'm seeing it. I'm seeing it. Okay, I've got one last question for you. Ozempic, Zepbound, Wegovy, all these new weight loss drugs. Are they helpful with metabolism?
They are unequivocally helpful with metabolism. I think that is irrefutable at this point. So for people who don't know the whole story with them, they're actually diabetes medicines.
Yeah.
They were developed for type 2 diabetes.
Mm-hmm.
And then, oh, it turns out, wow, some people, not all, but some people at higher doses can really lose a lot of weight. So they seem to be helping regulate metabolism and appetite. And now we've got more and more growing evidence that they're good for heart health. They might be good for liver health. They might be good for arthritis associated with obesity. But guess what? The human brain is an organ too.
Right.
And the human brain for some people can benefit. And so we actually have clinical trials now underway of Ozempic and other medications like it for depression, bipolar disorder, schizophrenia, and many addictions, alcoholism, cocaine addiction, nicotine addiction, and others.
Oh, I thought that was fascinating how these metabolic treatments help with alcohol addiction too. It's so fascinating because that's an easy one to look at someone and be like, you just need to stop the behavior. You just need to stop the behavior. And it's like, no, like get the brain healthy and it'll make it a lot easier to stop the behavior. Right?
Is exactly the way to think about it. And the solution is so obvious. Stop drinking.
Mm-hmm.
And yet when your brain is metabolically compromised, it makes it harder for some people to be able to stop.
Oh yeah.
And if you can help with a metabolic treatment, whether it's a ketogenic diet or Ozempic or something else, if you can help restore their brain health, then yes, then somehow they have the willpower, determination, and capacity to do it.
So cool. It's so cool. Thank you so much for the work you're doing. You're making the world a better place. Really appreciate you taking the time to be here today.
Thank you so much for inviting me. It was nice speaking with you.
Yeah, great talking with you too. Hi there. If you found anything in this video helpful, I would really appreciate it if you could give it a thumbs up or share it with someone who could benefit from it today.